listening to Planet Vero Radio. I am Cindy Schwartz, and we are talking some medical information today on the phone from Rochester, Minnesota, actually from the Mayo Clinic in Rochester, Minnesota. I have an orthopedic surgeon. His name is Dr. Bruce Levy. Dr. Bruce Levy. I said I was going to say your name wrong, Dr. Bruce, and I did. Dr. Bruce Levy on the phone, and he's got some unbelievable information for surgery, medical surgery patients that you're going to want to listen to, because I think a lot of people think every time you get into surgery, the patient always has to be naked. So we want to talk about that today. Dr. Bruce Levy, thank you so much. I know you're busy. You're giving me 10 minutes to talk, and I really appreciate it. So let's get right to the facts so we can help the listeners out and let them know what's going on with you and with your new medical garments. So welcome.
Well, thank you. Thank you, Cindy. I really appreciate the opportunity.
So let's get right to it, Dr. Bruce Levy. Why are surgery patients generally required to be naked for surgery?
Well, there's many reasons. One of them has to do with procedural access. So, for example, I do a lot of hip surgery.
Okay.
And it would be essentially impossible for me to do the operation and prep and drape the area if somebody had their regular underwear on, for example.
Okay. Mm-hmm.
The other is we typically need emergency access to the area of the groin in case there's a problem. There are some infection concerns if people come in with soiled or dirty underwear. There's latex issues where people have allergies. There's fire issues, flammability issues with different garments. And this is why the operating room and the FDA have set very strict guidelines for anything that's going to go into the operating room. Drapes and gowns, for example, have to meet all of these guidelines. No latex. They have to meet flammability codes. They have to meet cytotoxicity levels, allergy levels. There's all of these things that are required. So it's very difficult for you to meet those criteria and guidelines with your own underwear, for example. Okay,
so if you came in with your own normal daily wear and tear, even if it was a brand new pair of underpants, that wouldn't meet the guidelines.
You got it.
Okay. So we have to keep that in mind because, everybody wants to be safe.
Correct.
And infection is a huge thing. We hear about it all the time, MRSA, all kinds of things that you can't even sometimes cure, it seems. So we want to get on the same playing field. So talk to us about your garment. It's called COVR Medical Garment, and how you came about it and why you did.
So I do a lot of hip arthroscopy. And basically with that operation, people are spread-eagled with their feet in traction. And then we basically pull traction on one leg so we can insert instruments through these small holes and do the operation. And typically patients are completely naked, completely exposed, and essentially spread-eagled.
Okay.
And so I would constantly put a blue towel over their genital area, and there was really no good way to keep the blue towel in place. And every time we would move the patient, the blue towel would fall on the floor. And then I'm yelling at my residents, blue towel, and they would run and get the towel, and then the towel would end up on the floor.
Mm-hmm.
And it got to a point where I just said, there's got to be something out there that could provide some dignity and privacy for the patient and cover their genitals, but still allow me access to the surgical field to prep and drape and do the operation. Okay. And I went online and I went through all the different, medical suppliers, and I couldn't find anything. I couldn't believe it.
Mm-hmm.
So then I went down to the Mayo Medical Venture Department and I asked them to run a patent search, and there was nothing there either. So that was when I put my invention disclosure. Believe it or not, it was back in 2012.
Okay.
And we put our invention disclosure in. And subsequently, here we are, 5 years later, we commercialized an FDA-regulated Class 1 medical device, which is basically a garment that will cover your genital area and still allow me access to the hip and groin to do the operation.
And that's incredible.
And imagine something like a half short that has a retractable front panel and releasable sides to do this. So what people don't realize is the materials took quite a while because all this has to go through the FDA guidelines, as we talked about.
Mm-hmm, mm-hmm.
But it had to be a very, very smart design. And it was not easy to make a design that would keep you private, both front and back, so the genitals and both buttocks, and still give access to the medical team to the whole hip, groin, and pelvis area.
Right. And again, like you said, to keep the sterility factor, to keep the flammability, all these other guidelines that you had to jump through the hoops for.
You got it. Yep, exactly.
And so what do you find, Dr. Levy, patients accept this? I would think just like would applaud it and really breathe a sigh of relief that they can have something like this.
Well, I could tell you the patient response has been overwhelming, positive.
Yeah.
I don't think that there is a day that goes by when I operate on a patient, give them a cover half short, and then every day somebody will thank me, high five, say this is such a great idea.
Yeah.
I mean, it's been overwhelmingly positive, and it's so simple, and it just baffled me that no one had, put the effort in to come up with this before.
Well, one of the things that I would think of is you have inside information. So you know about the flammability, you know about the sterility, you know about different kind of guidelines, which maybe the layperson wouldn't know. And a lot of times it is internal, things like this, where you're working in the industry, so you have like firsthand knowledge.
Well, there's no question that helps.
Yeah.
But you know what we found surprisingly, and we did this to give patients more comfort, obviously, right? We felt that it was our responsibility to maximize patient privacy and dignity. It's just someone's constitutional right.
Yes.
And even though as medical providers we do everything we can to maximize the safety, protection, privacy, and dignity of patients, there just wasn't a good way to do it until now.
Yeah.
So I think best efforts were there, but now we have something better. And what we came to find out, Cindy, is that the medical providers, the technicians, the nurses, they're also uncomfortable. And so given the cover garments now makes everybody more at ease.
Wow.
And really enhances the caregiving relationship between the medical team and the patient. So it's not just the patients that are thankful, it's the medical staff as well.
Okay, that's excellent to know. That's excellent information. So we have like a minute and a half left. I want to get your name out there, your company's name. I want to get the product out there. I want people to know where to buy it. And I also want you to tell me, we talked right before we went on air that there will be bras available for women surgery patients as well.
So the patients can access our website at covermedical.com. That's COVR medical.com, and you could purchase the garments directly on the website. We are in the process of designing numerous different areas for patient privacy and dignity.
Okay.
And so we are working on all that. We're sensitive to all the areas, and so again, it's not easy. You have to be really, really clever on how these things get designed so that they function properly.
Okay.
They meet the guidelines and still give you the access.
Okay.
So it's not easy.
No, it doesn't sound like it would be either. It seems like it's going to snap, but not in reality. So do these garments just really quickly have to be brought into the operating room like in a sterile situation, like you wouldn't put it on before you went into the OR?
Oh, great question. No, these are things that these are garments that get put on when you get undressed in your preoperative area.
Okay.
So you get undressed, they give you a gown, they give you socks, and they give you a cover garment.
Okay.
And then you don't even have to worry about the gown because the cover garment covers both buttocks, and you put it on during or in the pre-op area. You wear it from the minute you get undressed to the minute you get back dressed.
Okay.
And so through the entire hospital experience, you can be protected with a cover garment.
Okay, for you gentlemen. So quickly again, I got like 15 seconds. Say it again, your website, and I'm going to say thank you so much, Dr. Levy. Unbelievable.
Thank you so much. Covermedical.com, COVRmedical.com.
And you're listening to Planet Vero Radio, and a huge thank you to Dr. Levy for talking with me for 10 minutes. I mean, what a whirlwind idea, and it's great for surgery patients. It's the Cover Medical garment, covermedical.com. You're listening to Planet Vero, and we'll be right back.